Good morning, good evening. I'm Richard Bradlow, and welcome to Substance Stories. I'm joined with me today, my colleague at the Victoria Clinic, Dr. Fergal Armstrong. Thank you very much for being here.
Great to be here. Thank you, Richard.
So, Fergal, I know you run a fantastic podcast called Cracking Addiction that's designed to help clinicians and doctors who work in the addiction sphere. And what we're excited to start today is a podcast specifically aimed at the general public. So whether that's people that are struggling with addiction, family members of people that are struggling with addiction, or just people that are curious about addiction from a sort of layman's point of view, that's what we hope to answer today. If you guys have any ideas or questions that you want us to cover during Substance Stories, write in and we would love to cover them. But today, as it is the first episode, I was hoping we'd talk about what is addiction. Now, Fergal, you are a huge etymologist. So what is addiction specifically with regard to etymology?
Yeah. Well, I think the word addiction, correct me, Latin scholars who are listening, if I'm wrong, but I think the word addiction comes from the Latin word ducere, dictum. I probably got that wrong, but basically to be led, right? So one way of thinking about it is addiction is really being led by the nose to do something that you don't actually want to do. Now, if I could further raise the bar in terms of the level of erudition, who's the guy that died? He played the Joker and he died of a drug overdose. He got an Oscar. Heath Ledger, right? So Heath Ledger's dad said, he basically said that addiction was basically where you feel forced to do something you don't want to do. And I think, there are many definitions of addiction from a clinical point of view and from a psychological point of view. But as a very basic introduction to the idea, I like the definition of the 3 R's. So it's a repeated engagement with a rewarding stimulus despite negative repercussions, which, to simplify, is basically feeling that you have to keep doing something that you can't give up even though it's bad for you.
Yeah, I think that's a terrific definition. And I think what I want to say very early on is what addiction isn't, what doesn't purely define addiction, is tolerance and withdrawal to a substance. So nowadays we really separate the concept of dependence from addiction, because if you look at the sort of DSM, which is the sort of American Psychiatric Handbook's definition of a use disorder or an addiction, it has 10 points that make up that addiction. And the last 2 are tolerance and withdrawal. Tolerance meaning you need more and more of the substance to get the same effect, and withdrawal meaning that you feel the effects of not having it when you aren't having it. And the first 8 are what we call the salience features of addiction. So they're all about the meaning that substance or that behavior has in your life. That it's damaging your work life, your relationships, your family life, your health, but you continue doing it, and that you're losing control of it. So you're taking more, you're doing it more than you mean to. It's taking up more and more time in your life. You've tried to cut down and you can't. And I think that's really important because, there are a vast amount of people that get in a serious car accident, require 3 surgeries, 4 surgeries, end up in hospital for 2 months and are on opioids every single day when they're in there. And towards the end of their stay, they go to the rehab unit, they engage in physical rehab, they wean off their opioids, and then they go back to their normal life. And they even though they had a tolerance and they would have gone through withdrawal if they hadn't weaned off it, they had a physical dependence, but they didn't have an addiction. A wonderful example of that, Fergal, is what happened to Vietnam veterans that I was helping you could tell me about.
Well, I probably won't be able to give you the story that you're looking for, but I think the point that you've made, that the vast majority of people are able to, undergo treatment requiring substances of dependence, and then when the issue is gone, when the healing has occurred, to then stop that dependence. That's how most people can deal with substances. But there is a group of people that can't get off, and there's usually a reason why they can't get off, and the reason why they can't get off it is usually in their past. I mean, so we know that trauma, for instance, means that you're more likely to have difficulties getting off a substance. And we know that, social adversity, we know that having an unlucky set of genes, these are all factors that kind of funnel into the end point of not being able to get off a substance. Another way of looking at it is, to think about the difference between substance use and substance misuse, and then substance dependence and or addiction. So a doctor may prescribe you something, it's use. You may, use a drug illicitly just for the fun of it, but then you can stop. It really is only, occasional use once or 2 or 3 times a year or something. But there is that group of people that find themselves being slowly reeled in to the point where they're dependent and they cannot stop. So we need to describe the terminology for each of those levels of experience. But going back to your question about the Vietnam vets, the short answer is I don't know. You enlighten us, Dr. Bradlow.
Well, I think it ties in wonderfully to what you said. So in Vietnam, the rates of opioid dependence amongst the US soldiers was shockingly high. And this freaked out the American government when it was time to go home. So what they did is they flew them all to South Korea and they made them all detox, and they couldn't fly home until they had a clean urine. But people thought, my God, all these guys are going to come back to America. They're going to get started back up on their heroin dependence. We're going to have this huge influx of heroin dependency. But a tiny number of them returned to heroin use. And the thing is, it was being in the Vietnam War was awful. And so heroin use was a reasonable decision to be made in that. So I think it ties into what you're saying about people more vulnerable to an addiction. And those factors are biological, so they could be genetic. Those factors are psychological, trauma, difficulty in your upbringing, and they're sociological. You could be in an active war zone. You could be in a domestically violent relationship. You could be in a life situation that is just hideous. So I think the cause of what make people prone to addiction are biopsychosocial, as we like to say. And it's about 10%, give or take, across all drugs of 10% of people that are addicted. That's slightly higher for certain drugs, but not shockingly so. And when I say that, a lot of people are quite shocked. They say, well, no. It can't be that 90% of people that use ice aren't addicted. And it's probably only 80%, but that still, I think, would blow most people's mind.
Yeah. So how would you describe the levels of use? What's the terminology that we can use for someone who's using just at the weekends and theoretically no harm has occurred just yet?
Well, look, there are so the DSM will use substance use disorder, mild, moderate, and severe. It used to say stuff like substance misuse. I like to talk to someone and get an understanding of how they use. And then I'll say to them, I think you have an unhealthy relationship with this substance. So I'm quite worried by someone that comes to me and says, I use because my life is so shit and it makes my life slightly less shit, rather than I like to use because it makes me feel good. There's this concept in addiction called hyperkathia, which essentially means
hyperkathia.
Hyperkathia, sorry.
Is that what you're talking about?
Yeah, hyperkathia, yeah. I think you knew that was what I was talking about.
Do explain to us, Dr. Bradlow, what it is.
So as an addiction progresses, your life gets progressively shitter. And so the negative emotions you're feeling are progressively worse. As well as the brain on a neurological basis, the changes in your brain, they're actually the negative emotional states in your brain are getting more and more pronounced as your addiction progresses as well. So I think hyperkathia is a really useful term, because I think about it, if someone's got a large trauma history or they're in a war zone, I say you've already got a lot of kathia.
You say that to your patients, do you?
No, I don't say kathia, but I say that you have a baseline level of awfulness in your life, which means that you're at a much higher risk for addiction.
Yeah. I was going to say, I like your statement that you've got an unhealthy relationship with substances. That's a useful way of conceptualizing certainly the early stages of pre-dependence. So how many people do you reckon are affected by addiction in Australia over their lifetime?
Yeah, well, including all substances, including nicotine and addictive behaviors, I would say it's about 20% of Australians.
Yeah, that's 1 in 5. So I think the important point to understand for anyone listening is that it's not something that you can brush under the carpet or close the curtains on it. It's amongst us. It's within us. We need to acknowledge its existence, and we need to. And how do you feel? How do you feel about the judgment associated potentially with these diagnoses?
Well, that's exactly where my mind went there, Fergal. So 1 in 5 Australians suffer from addiction in their life, yet there's still so much stigma towards people with an addiction, which is crazy to think that there is such a stigma about something that's so commonplace. And I think stigma is incredibly unhealthy because it increases the negative feelings you have and makes you less likely to reach out for help for addiction. And I think it is at the same time, making you feel worse about yourself and thus probably driving your addiction as well. There's a great way of conceptualizing addiction, Fergal, by a professor called George Koob from America that says addiction is the moment from when you stop using a drug because it makes you feel good and you start using a drug or engaging in a behavior because it makes you not feel bad. And that's what I always keep in mind with addiction. Talking of not feeling bad.
People will say to me, I take these substances now to feel normal. Yeah, they no longer get high. That's a key thing. When I hear that, that's an alarm bell. You've got a problem.
Yeah, and you could imagine if you have a lot of psychological trauma, or if you are in a hideous life relationship situation, that using something to feel normal would be more likely to occur than if you were in a less hideous situation. But talking of doing something to not feel bad, I think we have run out of time for today. So thank you so much for joining me today, Fergal. And
thanks for having me.
Those of you listening, thanks for joining us. We'll catch you next time.